And together, we will move mountains. And if they don't hear our message, then we'll just do it over and over and over and over 1,000 times again for you.
And I'll rise up, I'll rise like the day, I'll rise up in spite of the end. I will rise, we will rise, we will rise, we will rise up.
Hello, my name is Michelle Zabel, and I'm an assistant dean at the University of Maryland School of Social Work and the proud director of the Institute for Innovation and Implementation. So this year of working virtually has necessitated some really creative approaches to conferences. For us, we've spread the Training Institute workshops over the last 9 months, hosting just a few workshops each month. And I want to thank you for joining in these discussions and participating each month. This summer, we're continuing the Training Institutes in a way that will allow you to take us wherever you go. And I am hopeful that you are able to take a break and get away safely. We're going to be recording our summer workshops and releasing them each month so you can watch them anytime during the month that works for you. These workshops are going to be on a wide range of topics, all focused around strengthening your skills as you support children, youth, and families. A quick note, some presentation reference information and graphics that are embedded within the presentations may not be fully explained within the audio, but all of the presentations are accessible to download, as well as the resources and handouts that correspond to each workshop, and I encourage you to do that. Thank you for listening to the audio recordings of our summer workshops for Training Institutes Live. While you're enjoying these summer months and workshops, we'll be planning and working towards future Training Institutes when hopefully we can all see each other in person. Take care, enjoy your summer. Thanks.
Hello, and welcome to this presentation on culture and practice change for serving LGBTQ+ youth and their families. I'm Marlene Matarese, and I'm the Deputy Director at the Institute for Innovation and Implementation at the University of Maryland School of Social Work. And I'm also the Principal Investigator for the National Quality Improvement Center on Tailored Services, Placement Stability, and Permanency for Lesbian, Gay, Bisexual, Transgender, Questioning, and Two-Spirit Children and Youth in Foster Care. And that is funded by the Children's Bureau. This is a 5-year grant with the goal of designing, implementing, and evaluating best practices to support the needs of youth and improve policy and practice for youth with diverse sexual orientation, gender identity, and expression, or, which you will hear throughout this presentation, SOGI for short. The individuals on this panel today are part of the CLIC that I just described, and they're a local implementation site located in Cuyahoga County, Ohio. Over the past 4 years of this project, I have had the privilege of working with this team, and they have done exceptional work. And so I'm thrilled with the opportunity to be able to highlight that work. And I'm going to pass this over right now to Karen Anderson, who's going to talk about the work that they've done so far and all of their accomplishments.
Thank you. I'm Karen Anderson, as Marlene said, and my pronouns are she and her. When we began this work, our vision was to safely identify young people who expressed that they were gay, lesbian, bisexual, transgender, or perhaps questioning. And we really wanted to create an environment here, a child welfare organization that embraced everyone for who they were. And we knew that if we wanted youth to feel safe and accepted, that also had to include our staff, our caregivers, and other stakeholders associated with us. So our vision really became, how can we create this environment that recognizes people and embraces them for who they are and allows them to be who they are. We wanted to create a safe identification protocol for young people who wanted to or who were expressing their sexual orientation or gender identity, and to create affirming placements for those young people, whether that was in family-based care or in residential treatment with a residential treatment provider. And finally, we wanted to make the community aware of all of the resources that are available for our LGBTQ youth. So we established a theory of change that I've sort of highlighted a bit, including safe identification, and you're going to hear more about that, and affirming caregiving. We did training. We've done training with foster parents and kinship care providers, as well as with residential treatment providers, to help them understand why they should know about a young person's sexual orientation and gender identity, why they should not weaponize that information or use it against young people, and how to help their staff and as caregivers, how they can help young people and why that's important, and help them be comfortable with those conversations. And really, we incorporated 2 flagship programs, the Youth Acceptance Project and Chosen Affirming Family Finding, which targeted services toward young people and their caregivers to help those families and other stakeholders that youth were involved with have more affirming connections. So with that, I'm going to pass it to Corey Sewell, who will tell you more about safe identification.
Hello, everyone. My name is Corey Sewell, and I use she, her pronouns. I'm going to talk to you a little bit today about what safe identification is and what our approach to that was. So we use safe identification as a process to help young people with diverse SOGI feel comfortable talking to their staff at the Division of Children and Family Services. It's also something that we want to make sure that we explain to young people before we start having conversations with them regarding that their information will be kept confidential, that they are the owner of their own information, what we will be doing with information around SOGI, and that we would get their permission before we shared that information unless there was an immediate risk of safety that we needed to address. We also wanted to make sure that our young people knew where their information would be housed and how that information would be used. So we had to help our staff begin being comfortable having these conversations with young people, being familiar with the process so they could explain it to young people, and feel comfortable having their own questions and bringing those back to us so that they could get answers for young people and their families. So we used a phased-in approach regarding how we were going to get this information out and how we were going to do this process. And our first phase was sharing a SOGI 101 education session with our staff regarding SOGI information, what that meant, what different vocabulary and glossary terms they might need to know about. We talked to them about the importance of SOGI and why we were asking about SOGI. We used some general information about services that we had available, as well as the program, and we implemented a pronoun campaign throughout our agency, providing pronoun buttons to our staff with elevator speeches as to why we were having the pronoun buttons available. We helped put some things throughout our agency and our building to help with that, and to help people become familiar and comfortable using pronouns. The second phase was about the specific tailored services that were available and what the criteria for each service was so that our staff could become comfortable having those conversations with young people and their families. The third phase was group supervision, where we talked with small groups of agency staff about how they could use group supervision to help them have SOGI conversations as well as some other types of conversations. We did one-on-one SOGI conversations in practice to increase comfort level with having conversations around SOGI. And we also had a lot of Q&A with our staff dispelling myths and correcting language. Some safe identification tools and strategies we used were developing an agency-wide policy and procedure with input from young people and a variety of different agency staff on how our information would be collected, where it would be housed, how we would capture it in our electronic system and things like that. So all of those things went into the development of the policy and procedure. We provided scripts to our staff to increase their comfort level with talking to young people about SOGI. We adapted some tools from some other sites who were already having conversations around SOGI with young people. Again, kind of tried and true things that we knew might be available to help our staff and when they had questions. We used small group discussion and role play with direct service staff to practice realistic conversations with youth. I'm going to go ahead and hand this over to Jennifer Wendera.
Thank you, Corey. Hi, I'm Jennifer Wendera. My pronouns are she, her, and hers. I work with Connect, a nonprofit in Cleveland, Ohio that designs programs, services, and products to transform child welfare. And we provide the services associated with this project. And the services are focused on providing youth acceptance work with LGBTQ+ youth and families to support reunification and or permanency with affirming families, chosen family, and important people. The chosen affirming family guiding principles include youth have a right to leave child welfare with a robust network of support. And it is our job to help create those supports with them. With support and accurate information, families that are rejecting can and do change from accepting to affirming. Youth involved in child welfare experience loneliness, which is devastating and detrimental to physical and mental health outcomes. Healing happens in relationships, hence the necessity of building strong social support networks. Variations of sexual orientation, gender identity, and gender expression are part of the normal spectrum of human diversity. The increased risk faced by LGBTQ youth are not inherent to their identities, but stem from the struggles of prejudice, discrimination, rejection, and mistreatment. And finally, efforts to change a young person's sexual orientation or gender identity are harmful, unethical, ineffective, and unnecessary. We serve youth that are in foster care with diverse SOGI, with no permanency plan. We serve young people in foster care with diverse SOGI that have a permanency plan, but that could benefit from having a network of support. We also serve youth who have left their caregiver due to rejection around their diverse SOGI, and or youth that are at risk of coming into foster care because of their diverse SOGI. There are two interventions that make up the Chosen Affirming Family Program, the Chosen Affirming Family Finding Intervention and the Youth Acceptance Project Intervention. The goal of the Chosen Affirming Family Finding Intervention is to help LGBTQ+ young people in foster care create a network of support, be it family, chosen family, and important people. They're going to be able to create a sense of belonging, support, and unconditional commitment to the young person now and lifelong. What we've done is we've adapted Kevin Campbell's family finding model to meet the specific needs of LGBTQ+ young people and their families. Those adaptations include ensuring that the young person determines how, when, and with whom their diverse SOGI information is discussed and how it's discussed in the work. We ensure that if there are any immediate safety concerns specific to the young person's diverse SOGI, that we support creating a safety plan immediately. We also learn from the young person about what does affirmation look like and what affirmation do they need now, or how their team could better support them and be more affirming to them. And we also ensure that we support our young people be able to talk about who they want to come out to, and how that will look. And for young people that choose not to come out to their network or their family, that they have the support of this intervention as they determine next steps in that space. We also provide modeling, support, education, and referrals for LGBTQ plus resources and services, especially if family members, network members, chosen family, or important people are having difficulty in understanding the young person's diverse OG or needing further support to become more affirming and accepting. Some of the impact that we've seen is exciting. We have recognized that every young person has family, we just need to find them. We have worked with a number of young people that have been in care for a number of years, that have been completely disconnected from family, and found over 100 family members. We've also been able to locate a number of family members when that individual young person was unable to remember family members. And we learned that many of the family members that could provide family history, unfortunately, were deceased. We found that most network members have been accepting and affirming of their young person. We find that many of the families that have been disconnected from their young person for a number of years are very excited to be reconnected with their young person and have been navigating being accepting and affirming in many great ways. We've also seen that network members have become much more active in participating in team decision-making meetings that child welfare has when it comes to decision-making and planning for the young person's future. And we've also seen with support and coaching that our young people have been able to create plans, permanency plans for themselves, and are able to articulate well what type of support they need from their network, their family, and their professionals. And I will hand it over to Leah Love to talk more about the Youth Acceptance Project intervention.
Thank you, Jen. Hello, my name is Leah Love. I use she, her pronouns, and I am the Youth Acceptance Project clinician with Connect. The Youth Acceptance Project is an intervention that supports and promotes permanency, relational, emotional, and social permanency. We believe affirmative care needs to permeate through all social service platforms, particularly within child welfare. The Youth Acceptance Project works with young people that have diverse SOGI and are experiencing various levels of rejection from their parents, caregivers, family, or chosen family members. Major components of the Youth Acceptance Program is meeting family where they're at. This is done through rapport building and creating and maintaining a safe space for the parent, caregiver, family, chosen family, and the youth separately to express and process their true feelings. This engagement is supportive, it's non-judgmental, and it's always remaining curious. Staying in that curious space to learn more through positive inquiry and empathizing with the young person and or family that you're working with. Often we are processing various levels of fear, loss, guilt, and or grief. To demonstrate what this work could look like, I'm going to go over 3 young people and families served and just a brief snippet of what our work has looked like. For the first, we have a 19-year-old gender-expansive gay male. Upon opening of this youth and their family within the Youth Acceptance Project, youth was not out to his family. He was recently reconnected with his family through the family finding intervention. And due to this recent connection, he feared he would lose his family's love and support if they knew he identified in the LGBTQ plus community. This fear stemmed from his grandparents' strong stance in their religion. Working with this young person was around self-esteem, confidence, and self-love. When he was ready to, he came out to his grandparents all on his own. His grandparents expressed to him immediately that they loved him, and no matter what or no matter how he identified, that love would remain and that they want him to be himself. Once youth came out to his grandparents, I was then able to engage grandma around advocacy and around education and the effects of rejection and acceptance as well as affirmation. Grandma continuously, even to this day, expresses that she loves her grandchild and will protect him and his mental health at all costs. The next young person and family member I want to tell you about is a 18-year-old transgender heterosexual male. The work with this young person and their family was centered around helping his parents think beyond the binary. So helping them step away from cisgender heteronormative views of life and of the world. And in turn, this helped them relate more and better to their child with fewer misunderstandings. And there we were able to begin relationship building. We were also able to connect the young person with a number of mentors within the LGBTQ plus community for further support and connection. The last young person and family that I would like to talk to you about is a young person, 16 years old, non-binary, pansexual individual. This young person was very unique in the sense that we were able to unite this young person with their mother in another state on the other side of the United States, actually, in a very conservative community. We were able to identify a new up-and-coming LGBT center right in their town. This young person and their family will be connected to all affirmative resources that's available, including but not limited to affirmative health care, transportation, weekly clothes and food bank, financial assistance, and programming for the young person so they can connect with others in the LGBTQ plus community. So that was just a few families and young persons served through the Youth Acceptance Project. And I'm going to go ahead and pass it along to Ms. Elizabeth Greeno. Thank you.
Hello, I am Dr. Elizabeth Greeno with the Institute for Innovation and Implementation. And along with my colleagues, Dr. Matarese and Dr. Weeks and the rest of the QUIC team, in collaboration with Cuyahoga County, we implemented the Cuyahoga Youth Count. And today I'm going to share some of our findings. In fall of 2019, we replicated the Los Angeles Foster Youth Survey. So we consulted with the Williams Institute to implement the Los Angeles survey to make minor adjustments in the language and some of the methodology by adding actually text messages. And we had a plan for a lot of contact with the youth. So we had two methods that the youth were able to participate in the survey. They could either go online through a survey link that was sent via text message, or through a live interview with the call center staff. So over a period of four-week period, the youth were contacted a maximum of 6 times. The survey took about 20 minutes to take, and there was an incentive for taking the survey. Each youth were given $10 gift cards, and there was a weekly raffle for $100 gift cards. And you can see that there were quite a few text messages and phone calls made for the project. So in terms of my sample size, so the total eligible youth for the study were 817, and I had 251 youth complete the survey, so for an overall response rate of 31%. And of the youth who participated, so of that 251, 68% identified as non-LGBTQ, and 32% identified as LGBTQ. And just to give a little bit of perspective of where that falls, so what you're looking at are some samples from some recent studies done, some prevalence studies looking at the percent of youth involved with child welfare who identified as diverse SOGI. So one of the more recent studies in New York identified 34.1% of youth in foster care identified as LGBTQ. Again, we had 32%. A BAM study done in 2019 that was in California identified about 30% of kids. And you can see some of the other percentages there. So this was a pretty high prevalence rate. And again, I think it's just noted it was in a Midwestern state. We had a lot of different measures that we used for the survey. We asked about permanency experiences, general well-being while they were in care, their general experiences while in care, and then their perception of adverse or discriminatory treatments. And I'm going to go over some select findings with you. For foster care youth experiences, so you're looking at a column that are for the youth who identified as diverse SOGI, and then youth non-diverse SOGI, youth who didn't identify as LGBTQ. So you can see that their average numbers of years in care and placements are relatively the same between the two groups. It wasn't statistically significantly different, but you can see there was a difference in percentage of those who had been arrested on probation or picked up by police. There was a significant difference between diverse SOGI and non-diverse SOGI youth in terms of having spent a night in a hospital, with more diverse SOGI youth saying that they had spent a night in hospital, and the reason why they had spent a night in a hospital was more likely to be a physical or emotional mental health reason, versus non-diverse SOGI youth tended to spend the night in a hospital due to a physical reason only. So we asked the youth about their perceived treatment by the foster care system during the past year. The first row you're looking at are non-LGBTQ youth, the second are LGBTQ youth. And we had significant differences between the groups in terms of if they felt not very well treated, somewhat well treated, or very well treated by the foster care system. So non-LGBT youth felt, 55% of non-LGBT youth felt that they had been treated very well by the foster care system, compared to 32.4% of LGBTQ youth. Similarly, for somewhat well treated, 34% of non-LGBT youth said they had felt somewhat well treated, compared to 44% of LGBTQ youth. And then for the not very well category, 23.5% of LGBT youth compared to 10.7% of non-LGBT youth indicated that they had felt not very well treated. So the two main differences there are in the not very well category and the very well category, with definite discrepancies by diverse SOGI status. We also asked the frequency at which youth can be themselves, and they could answer either never, some of the time, most of the time, or all of the time. And again, we had significant differences between the groups here, with non-LGBT youth saying about 59% of the time I can be myself where I'm living, and 42.3% of LGBT youth said they could be themselves where they're living all of the time. The next biggest category where we saw a difference there was again with the nevers. So about 16% of LGBT youth said I can never be myself where I'm living, and 9% of non-LGBT youth said I can never be myself where I am living. We also gave them a scale asking about the adverse or discriminatory experiences they had had in the past year. And there were 7 items on the scale. And on average, so out of the 7 items, on average, LGBT youth said they had experienced about 4 out of the 7 adverse or discriminatory experiences, and non-LGBT youth said they had experienced 3 out of the 7 adverse or discriminatory experiences. And there are really 3 noticeable differences that were significant between the 2 groups. LGBTQ youth were more likely to say, I have been treated with less respect, I have been treated as if not smart, or I have been insulted or called names. And so from our study, we have about 4 main takeaways. One is the study, like many others, really found an overrepresentation of LGBT youth in foster care, and again, in a Midwestern state. And this really reinforces the need for child welfare agencies to collect SOGI data for children and youth in the system and then upon entry into the system. There were differences in treatment by SOGI status, and that suggests the need for changes in agency policies, trainings, practice shifts to reflect culturally responsive practice. Other findings also suggest the need for preventive supports that provide SOGI-focused clinical support and clinical treatments to support family reunification and family acceptance for children involved with child welfare system. And I am going to turn this over to Jennifer Grossman.
Thanks, Elizabeth. I'm Jennifer Grossman. I use pronouns she, her. I'm going to talk a little bit about recommendations for the field to sum up what our team has said. As a foundation, we would recommend that whether you're a child welfare system or a community services system or any other helping professionals, that you establish a system-wide policy for a procedure for safe identification. Safe identification is definitely, as you've heard throughout this presentation, the foundation for all of this. If you cannot identify safely, then we're unable to know if they're safe. We're unable to determine whether or not they're with affirmative caregivers, and we're unable to provide them with any tailored services that are individualized for them. So discussing some recommendations for the field, one of the first things that we would want everybody to really consider replicating would be a system-wide policy, whether you're a child welfare professional or whether you work for a community services agency or another helping organization, that you have this set of procedures that everyone agrees to about safe identification. That's the foundation, because if we don't know who our LGBTQ plus youth are, we can't determine whether they're safe where they are now. We cannot determine what kind of tailored services they may or may not need. And we can't determine whether their caregivers are affirming or where they're at in their level of acceptance. Another recommendation that we would strongly have would be that you integrate this work throughout all decision points. So as you're working with a young person, it's completely normal for young people to change their SOGI or to, discover throughout their journey that their SOGI is different than what they've disclosed in the past. So we want to make sure that information gets out to all the people that you work with and who work with young people, so that they understand that the conversation needs to be ongoing, not a one-time situation. And the privacy that you've already heard about from several of the other team members, knowing that this information belongs to the youth. We also want to recognize that intersectionality is extremely important in this work. A young person's SOGI is just one part of who they are. It does not define them, and it does not tell you everything that they need. So when a youth does disclose that they are part of the LGBTQ community, being able to meet them where they're at is something that needs to be done with all levels and all layers of their identity. So recognizing the need to really address that with them in person. You want to make sure that you have natural check-in points with all young people, making sure that they are safe on an ongoing basis, making sure that the tailored services that they're receiving are what they need at this current time, and making sure that the adults in their lives continue to be affirming, or other people that they are exposed to are accepting and affirming and don't need any help with that. We also want to make sure that we develop a cadre of LGBTQ champions throughout the organization. So something that we did at the child welfare system here in Cuyahoga County was to make sure that we had champions in all different areas of the agency. So anywhere from, the people who welcome you into the building to, your caseworkers, supervisors, all levels of management, and all of our supportive services. We also want to make sure that those champions are well-versed in what services and resources are available for young people and can tell people where to go when they do not have the answers to questions. A few other recommendations that we have are to establish that constant education for staff and all professionals. Anytime you can do this in a cross-training kind of way with other professionals that you work with, I think it's very advantageous for young people and for professionals, so that they can meet together and really see how this impacts their work at various points. We also want to make sure that we, take this all the way through to the community and the people who see kids in all domains of their life, whether that's school, whether it's at home and in the community. And this helps us create a resource network that we need to make sure that we have affirming professionals in place who are staff, who are caregivers, who are providers, and who are natural people in young people's lives.
Well, thank you all so very much. I think this is great information, and I have some questions for you because I have the privilege of knowing the work that you've done very intimately. And I think there's some things that would be really interesting for others to hear about. I want to start out from the very beginning. So when we decided to put an application out to be part of this Quality Improvement Center, you made the choice to apply, knowing that you had all of these other things that were going on within your child welfare agency. You didn't know how many LGBTQ youth were part of your agency, and you were about to embark on something that was going to be a heavy lift. What made you do that? Why did you decide to take this on, to apply and to dig in and really create this cultural shift, improving of the service array, and to make yourself vulnerable to others about where your areas of weakness are in serving this population? Why did you do that?
I'll take that, Marlene. We had done trainings and worked with our staff about a variety of diversity topics, but most, for this conversation about LGBTQ youth. And when we asked or surveyed our staff, it would always come back that about 2 to 3% of our young people were LGBT. And certainly we know there are more young people or people in the general population who identify, right? I've seen numbers 10, 11, 12%. So we knew we had a gap. Obviously, as a result of the Cuyahoga youth count, we now know what a significant gap that was, but we certainly didn't know at the time. We knew there was a gap. And for us, it was really a matter of equity, right? Not, equality. We gave all of our young people what we hoped were affirming homes and, good services through the community. But when we got to the idea of equity, we really recognized that there needed to be tailored or specific services that would help young people and their families, and that an affirming home for a non-LGBTQ youth might look different than one for an LGBTQ youth. And so you're right, there was a great deal of work, and in many ways it was a heavy lift at times, but the ability to, I think this offered a focused intention, right? Because when you're not creating a specific project, it's easy for it to get lost in all of the work. But when you're intentional, that's when change can be made. and we really decided that was important to us, and it's important to our county. Cuyahoga County, which is the Cleveland area, has been out and a leader in the state on many of these issues, and we just felt this was the next step.
That's great. That's really great. And Karen, you just mentioned the Cuyahoga Youth Count, and this is for any of you. When you got the results back, were you surprised? I see nodding.
I was slightly surprised. There were certain areas of the youth count that I was not surprised with. There were other areas that were surprising to me. Some of the inequity that Elizabeth talked about in her presentation was surprising to me. Some of it was not, and the variation in numbers. Some things I thought would be higher and other things I thought would be lower. I was a little surprised at the number of young people, the percentage that we should be looking at as, identifying. I knew it was higher than what we had, but I didn't realize it was quite as high, as I think it was around 32%. So that was a little surprising to me as well.
Mm-hmm. How about others? Were you surprised as well, or did this make sense?
I'm not going to lie, I was shocked. I mean, I thought when the LA Rise study came out, I was like, yeah, 19%. I mean, that's California, right? And, you can be free to be who you are in California. I mean, this is the sort of Midwestern perception. And I think, I guess I thought probably we could get close to that, but I certainly was shocked. And I think that's the significance of the study, right? That we're kind of this, Rust Belt Midwestern city, that Ohio, Cleveland by and large is a little bit more progressive than other parts of the state, but still we're Ohio, and I was surprised. And I guess I wasn't necessarily surprised that youth had, LGBTQ youth would have more harassment or didn't feel comfortable be who they are. And what that data does for us is that it gives us a target, and now that we know it, we can improve it, right? And that's the critical findings for me.
Mm-hmm. Yep, absolutely. Yeah. And so if you think about this journey that you've been on, and I'm speaking specifically for the Child Welfare Agency, I'm also going to have some really specific questions about the interventions. Do you think that there are things, knowing what you know now, that you would have done differently in this implementation process?
I think we would have definitely placed more importance on safe identification in the beginning. We came out strong with our SOGI 101 training and, making sure that, all staff heard about the terms, and we really, young people told us really focus in on the pronouns, because they really told us that was really important to them. But I think that there was more that we could have done to meet our staff where they're at in terms of having these conversations. And I think we're finding that out after just completing the phase 3 of the training that Corey talked about, just discovering how many people are still really struggling with it and how much work we still have to do.
Mm-hmm. I would add to that, just to reinforce what Jen said, that, I sometimes get frustrated, right? As a child welfare system, you think you've educated people, you've talked to people, and now they have it. Okay. So what we would do differently is I would acknowledge that's not how it works. You have to say the same thing over and over again, and you have to really give people the words and help them come up with their own words to make them feel comfortable, talking with young people. So that's.
Yeah. And you're talking about your staff right now, and so I'm interested in, we've been doing this together now for 4 years, and we've been able to watch you go through all of these stages. Do you see a difference in how staff talk about youth with diverse SOGI, how they're engaging these young people and their families? Like, have you noticed any difference among your staff?
I definitely want Corey to address this too, but I just wanted to say that, you know, what I think we've really all had an aha moment is that we've really seen that staff are able to ask the questions that they would have never asked before. They would have been too embarrassed, or, you know, they were just so stuck in this is how I feel that they wouldn't have even thought to ask, because isn't this just the way it is? You know, and isn't this just the way I should be doing my work? So I really do, I have seen a huge change. And Corey has done a lot of, you know, one-on-one work more than the rest of the team.
I would say that we have definitely seen change. Even before we did some of the phase 3 stuff with one-on-one with small units, I was doing one-on-one with individual staff who were having difficulty. And it was very rewarding for me in those moments to see oh, I never would have thought of it that way. Or so sometimes it was just shifting the perspective just a little bit, like make yourself a 14-year-old young person, right? And look at it from that lens. And so being able to do some of that work, I think, has been really helpful for the staff that we did that with specifically, but also with their peers. They've gone back and shared that information in their units. They've helped their supervisors do what I call supervising for SOGI. Because they've been able to share various perspectives with their supervisors. And so it's been almost a trickle-up effect, where we have started with the direct service, our line staff, and it has kind of worked its way up. And so, you know, I think we still, as the team has said, we still have a ways to go. We have new staff coming in that, you know, are getting some of this now from those supervisors who've been able to have some of these cases that Leah talked about and that Jennifer had talked about. So they're able to share those experiences as well. So overall, I think, you know, there's always room for improvement in my world, but I think that we as an agency have really been able to provide some beneficial services to our staff, and it has proven to benefit the youth.
That is amazing. And so that leads me to one of the things that's been so impressive with your site is your enrollment numbers. You know, that this across the entire Quality Improvement Center has been a challenge to first identify young people and create space for them to where they feel safe to identify, and then to have the services ready for them, and then to get them and their families to a place where they're actually going to enroll in these interventions, particularly the clinical interventions. And you've been really successful at this. And so can you talk about why you think that is?
I think that really it was getting the word out there. I think early on we kind of had our format as to how we were taking referrals. And we were able to, because again, this was a learning process for us as well. We were able to kind of streamline that process and make things very accessible to staff. We had times where we had packets put together, so everybody had a paper referral, and then me and Jennifer Krosman worked together on a digital referral, so they could get that referral and, you know, fill it out on the fly and then email it, so it wasn't printing and scanning and all of these things. So we really tried to stay on top of what would work best for the staff. We didn't want it to be a chore. If it was something extra, right, we didn't think people were going to do it timely. They'd get around to it, right? So really doing that, I think focusing on those early sessions that we did with the staff education sessions were very helpful to even put it out there, you know, that this is why we ask. And when we started bringing in some statistical information, it was aha moments for staff. Oh, that really is important. I didn't realize that. And so I think those sorts of things were quite helpful in explaining to them why we were doing it. I mean, when we did youth counts before, it wasn't explained really. I was like, well, what are you going to do with this information? And so really being able to explain the why behind what we were doing, I think was instrumental in getting staff to do those referrals. And, you know, then having a place to go to ask their questions, I think was incredibly helpful. It wasn't like, well, I don't know, and I don't know where to find an answer. We had kind of built that into this. We had built in a champions. Me, Karen, and Jennifer Krosman's names are everywhere throughout our agency. Like, if you have a question, contact one of these people, you know, we'll get you there. And then eventually we were able to develop a desktop icon that has a list of those champions throughout our agency. It has that digital referral. It has those scripts we talked about. It has those resources. So it's a one-stop shop for staff. They can open it on any mobile device. They can open it on any desktop computer. So to put all of that information in one spot for them, I think was critical.
Great, that's very helpful. And I think that's going to be helpful to others who are listening to this. If they're thinking about implementing anything like this, those are some things to consider. You know, something that I think was particularly challenging about this Quality Improvement Center is that we didn't start out with a large number of evidence-based practices to pick from to be able to implement. And so you yourself experienced choosing interventions that had certainly an evidence base and that they had been implemented in other places, but they weren't in a place to be fully implemented in the quick to get us to a place where we have evidence-informed interventions and something that's manualized at the end of this. And so, Jennifer, you talked a lot about the family finding model, and I know that you all had to adapt it so that it would actually be something that was meaningful and would work for this specific population of young people. Can you talk a little bit about what makes this model and this version of family finding different from the traditional version?
Sure. I think it really has to do with where we identified there was a need for making sure that we were meeting the needs of LGBTQ plus young people in the space. So what we found is there's been a lot of even smaller adaptations that I didn't even mention that we've had to kind of learn as we go. And I think really at the critical piece is we want to make sure that young people are really leading conversations around their diverse SOGI. So what we found is, you know, part of the family finding model that really permeates the entire model. So anything from when we're cold calling who we believe is a relative that's not even aware that this young person uses a different name, uses different pronouns, and how to navigate that space. So we've had a lot of opportunities where we've had to ensure that what we're doing is really meeting the needs of the young person. I think what we've also found to be really helpful is having conversations with our young people around what does affirmation mean? So, you know, having these conversations with young people, we're learning that, well, I'm allowed to live there. That's affirming, right? And having conversations about, well, actually, this is what affirmation could look like. This is what we're hoping you're experiencing. And being able for young people to be like, oh, okay. And really having conversations around what do you need and what does that look like? How could you get that from your parent? How could you get that maybe from the coach that is willing to be a part of your network now and long term? What could those behaviors look like? What could they do differently in the way they speak with you? And that's been really helpful. And that's really a lot of what it's part of that learning process is a lot of our young people and families has informed us what they've needed, and that has allowed us to continue to shape this model. And I think the other piece as well is just how knowledgeable our interventionists are about the LGBTQ plus community, around the resources within the community, so that when they are happening upon a family that is maybe struggling or having questions, that we're able to really help navigate and educate where we can, if that's what's needed, and if there is more needed, that we can refer them to another resource. And sometimes we've had families where we've been able to develop a relationship to the point where the family comes to us and says, I really affirm my young person, but I don't know if I necessarily understand. So I need help in understanding what non-binary means and what that looks like and how I can be more affirming. Can you help me? So I think it's, again, going back to we've learned as we've gone and continuously adjusted based on the feedback that we've gotten.
So I have one more question, and it's for you, Leah, saving the best for last. You know, being part of this Quality Improvement Center, that we have had some challenges getting young people and their families enrolled in the clinical interventions, specifically the clinical interventions that are for parents and are around reunification or creating those bonds again with family members. And you gave 3 examples, exceptional examples, of how this model worked for these young people and their families. And so my question to you is, why do you think that is? What do you think is unique about this model that makes it so impactful when you're doing this work with families, like you said, that no one would have ever believed they could have gotten to a place to move from rejecting behaviors to supportive and affirming behaviors?
Excellent question. Thank you for that. I believe it's a number of things. So throughout this presentation, we talked about our families and our young people are so much more than their diverse SOGI. And what we're seeing on the outside as far as the rejecting behaviors, it's a lot more to it than that. And once you're able to build that rapport and relationship with the family, so, outside of diverse SOGI, so they're able to trust you, and you have this safe space, you can begin processing where this rejection is coming from, or what we're viewing as rejection is coming from. As I kind of briefly mentioned, there is a lot of fear, grief, loss, guilt that parents and caregivers and young people are experiencing internally. And it's difficult to express that, especially to essentially a stranger. So in creating that relationship and that rapport, I think it makes it easier to kind of process everything else that's going on outside of SOGI and how it ties back and relates to SOGI and ties back and relates to that relationship. And meeting the family where they're at and being in their ailments, you're able to be transparent and genuine as well as they are. So you can kind of normalize the things that they are experiencing that sometimes maybe other service providers don't necessarily do. And then in normalizing their what they're experiencing and what they're going through, you're able to kind of to bring more positive light to negative things that have happened and that have been viewed as negative, and then just work on relationship building. I really hope that answered your question.
It totally answered the question. Thank you so much. So I just want to say thank you to all of you. Thank you for agreeing to be part of this presentation. Also, thank you for the very hard work that you've done as part of this Quality Improvement Center over the past 4 years. We are in our final year, and we are in a place to where, you as a field are going to start seeing manuals and briefs and documentation on all the interventions that have been researched and developed as part of this Quality Improvement Center, including the ones that were discussed today. I think all of us would agree that we are happy to provide any kind of technical assistance, consultation, advice. If anyone is interested in making these shifts within your child welfare agency and implementing models or interventions to improve your service array to support this population of young people and their families, you'll see at the end of the slideshow that there's a list of contact information, and you can reach out to any of us. You can also check out our website at theinstitute.umaryland.edu for more information on the Quality Improvement Center and all of the work that's going on. So again, thank you all very much for being part of this, and we look forward to seeing what's next from Cuyahoga.